Hello. Today we're talking about how joined up data can help both clinicians and patients. And I'm talking to Ian McKenzie, Physician Executive at InterSystems, and Yossi Cohen, Clinician Advisor at InterSystems. Ian and Yossi.
Hello.
What do you think the biggest challenges are for healthcare in the UK?
I think at the moment, overwhelmingly, the biggest challenge is the ageing population, which is going to create a strain on our acute healthcare sector, both in terms of volume and complexity.
And this creates a lot of information, medical information, which is scattered all over the place per patient in multiple care settings, and a clinician providing care for a patient rarely is able to see the whole picture. If I see a patient in the emergency admission unit at 6 o'clock in the evening, and I can't access even the GP summary, not to say the GP notes, I cannot provide, unfortunately, optimal care for this patient.
Okay, so the buzzword at the moment is health and care. Can you explain to me what health and care means?
Health traditionally refers to the primary care deliverers, the general practitioners, and secondary care, the acute care service. However, patients have a need for a whole other range of services, pharmacy, mental health, that are based in the community, and that represents the care sector. Both acute healthcare and the care sector in the wider community are needed to maintain patients in a healthy condition.
So what's the biggest challenge to this kind of joined up thinking?
Well, people often think that this is a technological challenge or a problem, and this is not the case. We have the technology. We implement the technology. It's done. It's not easy, but it's doable. The main problem is cultural, and we have 3 different groups of people that we need to educate eventually. The patients, they need to consent for the information to be shared between multiple care settings. Otherwise, no one can see the whole picture. The IT folks, if you go to a hospital, normally you see the hospital, a car park, and then the IT building. The IT folks rarely walk the same corridors with the patients and the clinicians, and we need to give them that clinical context that will make them understand that they are front-line players. And the clinicians, of course, clinicians see IT and software, anything between a necessary evil to some kind of service. And we need to make them understand that this is as important as medications.
Okay, I want to drill a bit deeper here. How exactly can clinicians benefit from medical informatics?
I would turn that on its head and say that actually the key focus of this effort is the patient, and the patient will benefit because regardless of where they are, which care setting they happen to be in, they're going to get the right care at the right time with the person who's looking after them understanding everything that's going on about them. I mean, I used to work in intensive care, and it would be very common, for example, for us to receive patients who are acutely unwell in intensive care and have no access to any of their background information.
What would you say to a patient who's reluctant to share this kind of personal information?
I would just give him an example from his own record and his own condition, how sharing the information will help him when he's in need for care.
And how are we going to make this kind of medical informatics a reality?
Well, I think it's about education, and more education. We need to be able to explain to the patient why they need to consent for sharing the information, otherwise the whole thing will not fly. We need to help the